From a physician point of view, I just want to say how much I'm enjoying working with people who have gotten the blood test, the new MVX Plus blood test. So, oftentimes when you get labs, it's a CBC, a CMP, you're looking at liver function, your kidney function, you might be looking at your thyroid, looking at different aspects of your white blood cells, red blood cells. And oftentimes for your average person, everything's going to be normal, which is great. You want that to be normal, but it's not really giving you more information that could be actionable. Okay, so this is coming from my perspective as a holistic thinking doctor and someone who uses more concepts from functional medicine. So I want to be proactive, right? I don't want to wait until there is a problem. I'd like to see the early signs of a problem and then be able to educate whoever it is I'm working with so that we can manage that, we can deal with that before it ever becomes a problem. And that's one of the things I'm really enjoying about MVX Plus. So I've seen some folks and I've had a chance of looking at their, quote unquote normal labs, and then seeing their results from the MVX Plus. And what's nice is even if their labs were more or less normal, I mean, maybe there was some minor, something was a little bit high or a little bit low, but overall their labs just look great. But with MVX, what's awesome is I'm able to see, you have exposure to some kind of toxin, or you are actually inflamed. Or the other thing that I'm seeing is for a number of folks, they're actually showing a picture of malnourishment. And the malnourishment could be from not eating enough proteins. Could also be that their small intestine has some kind of disruption that is making it such that they're not able to absorb what they should be absorbing. So it gives us something to work towards. It gives us a plan of action instead of waiting years until that becomes a problem. We can actually address it. We can fix it right now. So, for those of you who see patients, whether you are a physician, whether you are a nutritionist, you could be an acupuncturist, you could be a chiropractor that deals mainly with nutrition, you could be a health coach, you could be a nurse that tends to work with a lot of people. This test is awesome. I really want you to learn it. I want you to start using it with your patients, and ask me questions. Put questions in the comments. But this is something that if you like to be proactive and you're working with folks, this is a great test. It's gonna just give you a lot of insight. And it's also going to let you know that you're going on the right track. It's going to let your patient know that whatever modalities or therapies that you're doing, you're going to be able to test to see how these are working. Are they effective? And is it really helping the underlying root causes of helping the biochemistry and the physiology? Okay. Please like and subscribe. Share this with other folks that are into their health. They like being proactive. And I'll see you in the next video. Thanks. Bye-bye.